With that, I'm going to now introduce our final speaker, like big presentation speaker. It is my honor and excitement to introduce Dr. Yusra Shawar to come up on the stage. Dr. Shawar is an associate research professor at the Hopkins Bloomberg School of Public Health, with a courtesy appointment at the School of Advanced International Studies at SAIS, just down the street. Here, SAIS is now here. I applied to SAIS, I didn't get into SAIS. But yeah. A public administration and policy scholar, she studies the politics and governance of health and social policies in low and middle income countries. Her research in the Lancet and other leading journals informs advocacy and decision-making on health and social issues, and she has served as a commissioner on 3 Lancet commissions, including this commission on adolescent health and well-being. So she is an expert on the Lancet commission. So thank you for sitting through this, and welcome. Thank you.
Thank you for the nice introduction. I know we're all kind of antsy towards the end, so I'll try to make this as lively and as quick as possible. So I'm going to forewarn you. I'm going to talk a little bit about challenges, but then I'll get to, rather than telling us all what we need to do, I think I'm just going to pose some questions around political priority for mental health specifically. So just to provide a little bit of context, I study the politics of policy processes, why issues do or do not get on global agendas. Unfortunately, this is an issue that doesn't have as much political traction. So I'm going to tell you why that's the case for adolescent health and well-being largely, but then at the end, we'll go specifically what this means for adolescent mental health. So I think it's always important, when I mean global political priority, what I mean by this is the degree to which leaders, global and national, pay active attention to an issue and devote resources commensurate to the issue's severity. So I just want to talk about what motivates my research, because I think it provides useful context. There's 3 observations that motivate this research. One is that this observation that the global agenda is very crowded. I just want to remind everybody of that. So we have like a lot of issues that our world is having to pay attention to. So it's not that this issue is not important, it's that it's competing with a lot of different issues. And only a few get elevated to significant priority. The second observation is that over the last 25 years or so, we've seen a proliferation of issue-specific networks. And what I mean by networks are they're actors that are networks that link funders, academics, NGOs, multilaterals, bilaterals, academics, everybody in this room connected to a particular concern. So some have formal governing mechanisms and others are just loosely governed. And the third final motivating observation is that there's this, and this is actually really ironic that this comes after data. So there's a common assumption that evidence is enough, that if we just show up and show the decision makers, like, look at our data, that they'll actually act on it, right? The reality is, that's not actually how reality works. So evidence does matter. So I'm not just trying to discount that. It's important. That's why we had a panel on it. It does matter, but what I want to make the point and the plea is that political strategy does just as much, if not more. So we need to pay attention to that. All right, so these questions are what motivated this question that I have around, to what extent does the effectiveness of these global networks explain why some issues get priority and others don't? And I've conducted with colleagues more than a dozen case studies. Some of these are listed here in case you're interested in what's kind of my comparative reference sometimes when I talk about these issues. But here's the main headline. Networks do actually matter, but they're only one part of the story. So there are other factors that we have to consider when we think about global political priority. Our research shows there are 3 broad categories that matter. One is the issue itself, the characteristics of the issue. Is it seen as solvable? Are there clear, affordable interventions, or is it viewed as too complex or stigmatized? The second is policy environment. So are there policy windows, resolutions, or global moments that is easier to elevate that particular issue? And then finally, the network of proponents that work on it, so you all. How well do these actors who care about this issue organize, frame the issue, and build alliances? So I want to just focus on you all, the network itself, and some of the challenges that our research identified with this group. And here I'm talking widely about adolescent health and well-being. We'll get to then what does this mean for mental health specifically. So across these issues, we see not just this network, across all networks that we've researched, we see 4 reoccurring challenges that can either strengthen a network's ability to generate political priority or hold it back. The first is problem definition, and this pertains to how members of a network internally understand the problem and the solutions to the problem. And this matters because when there's internal agreement, it's much easier to speak to funders and policymakers and convince them to do something about your problem. The second is framing. So this pertains to how network members portray and present the issue to outside audiences, often those audiences who have and hold the money and decision-making ability. So these are ministers of finance, donors, multilaterals. And this matters because different messages resonate with different audiences. So you have to keep that in mind. The third is governance, and this concerns the institutions that networks establish to facilitate collective action. Obviously, this matters because good governance enables a network to kind of steer to collective action together. And then finally, the last challenge is coalition building. This pertains to the recruitment of allies beyond like-minded people, so beyond the people that already care about this issue. And this is really important because actually most networks are pretty insular and they don't reach beyond people who think like them. And that's really important to achieve your own objectives. All right, so now, oh, is it the same problem? Next slide. I'll keep talking because we all want to leave. So I'll keep talking about, given this background, what I asked is then what has shaped global priority for adolescent health and well-being, and really why has it been not given that much attention? And specifically, again, looking at this particular network, let me see, oh, perfect. And then methodologically, what I did was I drew on interviews with leaders and observers in major organizations who deal with this issue, some of whom are in this room, and we reviewed a comprehensive, lots of documents and peer-reviewed literature on this topic. The goal wasn't to produce a scorecard, the goal was to understand the barriers to political traction. All right, so in terms of findings, in short, adolescent health and well-being faces serious challenges across the 4 areas I talked about. I'll get to that shortly. But I do want to emphasize that those challenges are made harder by the nature of the issue itself. So I can't blame we can't just blame the network. We have to think about how this intersects. So obviously this is one that we've been talking a lot about, but adolescent health and well-being is multi-sectoral. It spans health, education, social protection, justice, employment, violence, so on and so forth. So there's no single entry point to this sector. Also, adolescents are not one group. We've been saying this also. The needs of a 10-year-old are not the needs of a 19-year-old or a 24-year-old. Third, as a group, this group has limited direct political power. And then finally, given the last panel, data and measurement gaps, while there has been significant progress, remains both on terms of measuring the burden, but also on effective solutions. So all that makes adolescent health and well-being harder to champion than something like, for example, newborn survival, where the target is much more clear, the interventions are relatively more simple, and the message is actually more emotionally and politically simple there. Okay, and then this is the other big heavy slide. So there are also several challenges, the 4 challenges that are internal to this network. So the core internal challenge is one of the core internal challenges is problem definition. There's still no shared answer to 2 basic questions. One is, who is the adolescent? Different actors and institutions use very different age ranges. So in some frames, it's 10 to 19, in others, it stretches to the late 20s or even the early 30s. And there are totally different legal categories, service platforms, and budgets. And without clarity on who we're talking about, it's very difficult to present a unified ask to funders and ministries. The second is, what exactly does this agenda encompass? So there's disagreement on what adolescent health and well-being covers and what should be prioritized within that. So I've, even just in this today, we've heard, sexual and reproductive health rights. We've talked about mental health, obviously, but what about HIV/AIDS, injury and violence, education, livelihoods, NCDs? There's a wide range of issues. And so what's the face of this agenda? And what's the kind of rank order or priority, or how should it be presented or understood? So even inside this community, there's debate over the scope and over which issues should be the face of the agenda. And that lack of alignment really weakens the case politically. The second point is positioning. So there's also this tension about how to frame adolescent health and well-being to decision makers. And it's interesting because I've been hearing it subtly as people have made their presentations. So some proponents use an instrumental framing to invest in adolescents because it produces returns, whether it's economic productivity, stability, long-term savings, right? That's one framing. And others use a rights-based framing. They tend to lead with, adolescents deserve dignity, safety, voice, and health for their own sake. So both framings are morally valid, and the tension here is strategic. So are we presenting adolescent health as a means to other outcomes that ministers of finance already care about, or do we just insist that adolescent health is an end in itself? And the debate really isn't resolved, but it does really affect how the issue then is pitched globally and understood. All right, the third internal challenge is governance. This sector, as we've been hearing, is quite fragmented. There are many actors across many sectors, each focused on different parts of the agenda. There's no single widely recognized global home for the adolescent health and well-being. I mean, you can think about UNICEF, WHO, World Bank. Is there a home for adolescent health among those even? The expansion from adolescent health to more recently adolescent health and well-being has actually widened the scope, but it's also blurred ownership even more. And some argue that adolescent health and well-being really needs to have its standalone structure. And others, interestingly enough, argue that it actually works better if you embed across multiple platforms. So within SRHR, within mental health, within NCDs, you're talking about adolescent health. So those are two very different governance approaches. And within this community, people differ about how this should be done. And so this disagreement really weakens the ability to then coordinate and speak with one voice about what's your strategy. All right, and then finally we get to coalition building. This is also quite inadequate. People in this space, I think, really recognize that you just can't talk to health insiders. You need meaningful adolescent engagement, plus alliances with actors in education, social protection, justice, employment, and so on. But there are several barriers here that show up. The first is that the field itself is fragmented. The second is that there's actually sometimes, and I saw this a bit in my interviews, some resistance or turf protection from neighboring communities, including maternal, newborn child health groups that may feel that their own agendas are already underfunded. So how much do you take in and work with adolescents, or how much should that be separated? And while everyone agrees that youth voice matters, the mechanisms for genuine adolescent leadership, not just obviously token consultation, are still quite uneven. There's been a lot of progress, but as we've been hearing, it's uneven. And so the bottom line is that the coalition isn't broad enough yet or coordinated enough to generate strong political pressure. So I promised I wouldn't end on sad things. So these are the challenges, and I think it's important in order to move forward, you know what the challenges are. There are very great opportunities that I think this community can leverage. So on issue characteristics, and these are some things I've been hearing about even just in this across some of the panels. On issue characteristics, efforts like the Global Action for Measurement of Adolescent Health and multiple Lancet series are working to fill data and measurement gaps. That's great. On governance, there are frameworks like the AHA that try to align UN agencies and provide at least some common reference point. So that's good. On the broader political environment, we saw that COVID, while in and of itself was quite damaging, I think we all agree that it pushed issues like adolescent mental health, school-linked safety nets, and vulnerability in crises into the spotlight. Also, things like digital platforms, which are rising, are also giving adolescents more direct voice and visibility. So that's an important thing that can be leveraged. So all that to say is that this is not a stagnant space and that there are opportunities to build from. So finally, I wanted to end, I realized that all of this was just, the research was on adolescent health and well-being largely, but I think it's important to think about, so what does this mean for this community, adolescent mental health? And there are some important points that, that align with each of these 4 challenges that I'd like to raise. So with respect to problem definition, who is the adolescent in the mental health agenda? Again, here, are we talking about the 10-year-old in school with self-harm risk or a 24-year-old dealing with depression linked to unstable work and migration? These are not the same systems, budgets, or ministries. If the target group isn't clearly defined, it's very hard for governments to assign responsibility or money to the issue. So adolescent mental health proponents have to decide, are they pushing a broad adolescent mental health agenda, or are they starting with something more politically specific? So for example, school-based mental health support for 10 to 19-year-olds. There's also a scope question. Is this agenda mainly about depression, anxiety, self-harm, and suicide risk? Or is it also meant to cover violence, online harm, economic stress, and climate distress? The more that's included, the more accurate it is, no doubt. But the harder it is also to sell it as a solvable, fundable problem. And so I'm not, don't misread me, I'm not saying to do one or the other. I think it's important to just lay it on the table as to what needs to really be thinking, what we need to be thinking about. Because without the clarity of what we mean, it's difficult to have a focused ask. And then secondly, on positioning, there are 2 competing ways, again, that we can talk about adolescent mental health and how it's framed. Again, one can be the investment frame, which is, support adolescent mental health now to prevent dropout, violence, long-term health costs, and unemployment later. And the other, of course, is the rights frame, which is, adolescents deserve safety, dignity, care, and agency now, regardless of the economic return. Both are valid, but they land with different audiences. So finance ministers tend to respond to the first, youth advocates in the public tend to respond to the second. And so then the strategic challenge is, how do we use both without letting one cancel out the other? Or how do you kind of merge the 2 or talk to different audiences accordingly? And then third, almost there, is on governance. So should adolescent mental health be advanced as its own area with a clear lead agency, a defined budget line, and someone who can be held accountable? Or again, should it be embedded across existing systems within schools, within violence prevention, within social protection, and treated as something multiple sectors are responsible for? So if proponents argue it's everyone's job, then who actually is in charge? And which ministry or global actor can credibly coordinate so that it doesn't become, it's everywhere, so it's nowhere, And then finally, we get to coalition building. The key question to ask is, who's missing from the table? Are there people within this room representing education systems, social protection, labor, digital platforms? And how are these actors being brought in as true partners, not just as observers? And the same question comes for actually engaging adolescents themselves. What does meaningful adolescent engagement look like? I was pleased to hear a lot of conversation around that. And then finally, how does adolescent mental health sit inside the broader RMNCAH or life course architecture in a way that is visible and resourced without being sidelined or treated as a competitor or for resources or money. Yeah. So I guess just in conclusion, these are just, my intention here was not to pose technical questions or to say that I know the answers, but I think it's just important as a community to, as we move forward, to consider the political questions at hand. They're central if the goal is to elevate adolescent mental health in a durable way. So thank you.
Thank you very much, Yusra. And I wanted to thank the panel before, the measurement panel again. That was a wonderful discussion. So now comes the time for discussion and questions from the audience. And we want to open the floor right now for, as you walk away and as we think about what are steps for action to move this agenda forward, what's resonating with you from yesterday and today? What's one thing or two things that you think, oh, this is an issue that we need to move forward. This is something that we need to really take a deeper dive into. This is one area that, sticks out in my mind as a key to moving this agenda forward. So we want to open it up. You can ask questions, you can make comments, but it looks like B4 has something to say.
Hi, everyone. I do have a question. It was, I think, with the session that Professor Rebecca Fix moderated, I wanted to follow up on a question. My question was based on the fact that given that adolescents thrive in a two-parent household, how do we, and I'm curious about how much leverage we can give to the protective influence that a two-parent household does give adolescent, because we were talking about all of these things about adolescent, but I think beneath this understanding is the realization that adolescents are growing up within a family context. And the literature is suggesting that a two-parent household is very important. So how do we leverage on the protective influence of families such that, households do not, fall apart, and we're able to keep two parents together to ensure the optimal development of the adolescent? So that's my question.
So I'm not going to answer all the questions. Those are questions for the audience to either consider, or if someone would like to respond, we have Maya with a microphone who's going to help people to respond to questions or ask questions. But thank you. Before, we'll put that question on the list of things to consider. And if someone would like to respond, feel free to. But if others have questions, also please feel free to go ahead. You can either stand with the mics or respond. Go ahead.
Well, so I was going to respond to that because my understanding has always been that adolescents thrive with at least one trusted adult. I haven't seen literature that's talking about a two-parent headed household. It is more about having that stable, trusted adult who they feel they can turn to. So I didn't know if there was something new that has come out, but I think that it's an important piece to keep in mind with adolescent mental health. Like, I know that my household was better once my parents divorced, because it got rid of tension, abuse, and and issues. And so I think it's really important that we lean into, when we're talking about adolescent well-being, that we're leaning more into reminding all adults that one trusted adult can be a life changer for any adolescent, and that it's not focused on this keeping the two-family or the two-parent headed household, which can be more detrimental in many contexts.
And we have Cosmos.
I had a question, but to piggyback off of what this beautiful lady with the beautiful hair just said, I think sometimes it's more about like found family than like biological family sometimes, and your biological family could very well be a part of your found family. But I feel like in my experience, so I'm still in adolescence, and amongst my peers, I feel like found family helps a lot more because, like you just mentioned, sometimes your actual biological family can be the source of stressors or source of problems, or your parents in general could just be antagonistic towards you, man, relationship with them. But if you have somebody else, your found family or that one trusted adult, it can help mitigate um, stressors and problems and developing deeper into type of mental health disorders issues. So I'm glad you brought that up. But my question that I like to pose to anyone here is when coming up with research questions, when you are trying to do anything involving adolescents or adolescents involved in the creation process of said questions. Are adolescents involved in the creation process of the questions for like the surveys that researchers use to gather information about adolescents?
I'm gonna ask Shoshana to respond. Give us an example from Global Early Adolescent Study. What was the role of adolescents in actually forming the questions?
Yeah, thank you. I mean, I think research processes differ a lot across studies, and again, it gets, I think, a little bit at some of what came up in that excellent panel on measurement around really the purpose of a research study and kind of trying to fit the measurement tools and the questions to the actual purpose of the study. But that being said, in all of our work that we do in the Global Early Adolescent Study, which I work closely on, we do pretty intensive processes of formative development for any measures that we use. And that's particularly important, I think. I mean, it's important anywhere, but it's very important in the type of cross-cultural, cross-national work that we do in that study to really make sure that we are accounting for some of the important contextual and cultural variations that we see. And also just sort of fundamentally with young people, making sure that language is youth-friendly. Like I think we often, and what that means in different contexts, I think can differ pretty dramatically. And so to answer that question, yes, I think it's, really important to involve young people in the questions themselves. And that's also important, like what questions should we be asking? Right? I think that's a separate issue, but also another important point of involvement.
Thank you.
And you should know that if you're sitting in the room, you're fair game to be called on.
Yeah, thank you, Pam. The end of that day, just put me right on the spot there.
That was very good. I'm gonna Brandon and then Teresa and then.
Just a huge thanks again for this wonderful convening, and it's great to see so many people still awake and engaged at the end of the day. And I hope that we can all reconvene in some way in the future. Just one takeaway I wanted to share, and maybe kind of something for us to all think about together, is kind of the idea of local projects, global metrics. But I think, especially in light of the last presentation, being able to move things globally in the current moment is going to be quite challenging, and that may continue to be the case for the near future. And there's been such great, presentations from folks in Maryland, folks in Colorado, elsewhere in the States, or other kind of local regions nationally. Can we think about what local projects might be, but really making sure that when we're doing those, that we're as much as possible engaging with global metrics. So how, whether it be a school program using history as a tool or an arts-based project, thinking about the gamma metrics, the global school health survey metrics, the MAP metrics, positive well-being metrics, but using those things that globally we are trying to count, so that we can look at local projects as a way that moves the needle on those global metrics, rather than maybe doing a really powerful local project, but not having metrics that allow you to dialogue with some of these global indicators that we're trying to work towards. So just wanted to leave folks with the idea of local projects that we can do even in hard times, but as much as possible, global measurement frameworks.
Thank you, Brandon. Sorry, right behind you.
I don't know if you get up. So a takeaway from me that has really struck me is the progress we've made in randomized controlled trials, effectiveness studies in different cultures and contexts.
And I'm wondering, as a field, starting with the places where the burden of mental health is so high. And so I work in war affected countries and I see how much we're not doing. I see the care gaps. And I just wonder, you know, from the last presentation, can we learn from HIV and AIDS as a movement that led to things like the Global Fund, which led to an implementation science-focused scaling of evidence-based care while strengthening health systems? Can't we do this for mental health, especially maybe starting with a topic like children affected by war, because we're seeing with Gaza, Ukraine, Sudan, it's in the news, people are unable to turn away finally. And an initiative like that, taking lessons learned from what worked for HIV AIDS, knowing that the time's very different and that came out of a very different moment in history, but we're in another moment when it comes to war and children and thinking about trauma. And could we then take from like other models like the US National Child Traumatic Stress Network that started 20 years ago, 17 sites, and now it's in every state, 220 sites. Can we, from Gavi, from the Global Fund, can we take this moment of political will and lead to something that then could spread to other mental health scaling for other forms of trauma next, climate disasters, child sexual abuse, trafficking, and then just mental health system strengthening? Like, what is it going to take to do that? Because I do see that we're in a political will moment. And as someone who cares about the, you know, the political economy of trying to get things ahead, I want to lean into it, but it's the worst timing ever when it comes to funding. So I'd love your thoughts and advice. Just your presentation made me think of that, and then as a group.
We'll let you respond and then we'll go to the other one.
I mean, I loved your ideas because I think we could all initially just say like we're in an awful moment in terms of funding and scarce resources, and but I appreciate the positive spin that you've put on it, that actually we are in a moment where people are actually recognizing that this is an important component and an important life stage that we need to focus on, and that there are policy windows amongst us and you know, willing institutions that want to do things. So how do we build systems around that? So just actually wanted to echo back that I think these are the kinds of things that I think we need to think about, these political strategies as we move forward. So great.
Thank you. Question over here.
Oh,
Yeah.
can I try to answer a question?
Okay.
Yes, I'm not an expert, but my thinking to your answer is that we need to make people realize mental health is body health. I feel like one of the main reasons why the HIV, like, what was the initiative went so well is because we was able to firsthand see how it affected people physically. But mental health for so long has been so detached from physical health. And echoing back what was said yesterday, you cannot detach your head from your body. Mental health is physical health. And I feel like once we start shifting how we frame mental health as just part of physical health, just part of health as part of well-being, it will help further our mission. Because I feel like there is evidence out there that suggests or proves that how mental health can affect your body physically. And just because it might not be as physically easily visible doesn't mean it still doesn't affect our body physically. So once I feel like we shift the perspective of mental health actually being physical health, it's just health in general, it might help lead the initiative of, you know, solving those problems in the global fund. That's my thinking.
Thank you. Please.
Can you hear me? Okay.
Yes.
Yeah. I've noticed a small gap in all of the really excellent literature that we've talked about today. And it comes in two parts. The first part is the never-ending challenge of the personal narrative of parents and adults and those older than us from every generation. So every single time, like, we can bring up all this data, but at the end of the day, there is still like a narrative of back in my day. And I think that is just a piece to consider going forward. And the other piece is history in the past. Like, I know not everybody here studied history. That's just the thing that, you know, everyone has a little different pieces of, whether we have a specific interest in it or not, or we just learn about it in passing. But like, the other side is using this against us, whether we like it or not. They're trying to get rid of history, they're trying to rewrite it, and some even weaponize it, as in, say, the departure of my poor classics field. If you don't know about that and the history of racism that comes with it, please ask me. So, yeah, wondering what we can do about using the past to our advantage instead of the other side's. Thank you.
Thank you. Go ahead, Gloria. And actually, while you're walking, Fauzia's got a microphone, so go ahead to the mic and look.
Thank you. Should I go ahead? Yeah. Thank you. Just a couple of random thoughts. But before that, just to say, I really, really enjoyed the last day and a half. I'm a long time UNICEF, so for me, it's about under 5, and still, why are our kids dying of pneumonia, diarrhea, and all of that? So I found the last day and a half fascinating, and I learned so much. So thank you, everyone, who spoke or who shared things. I wanted to add to your positive ideas. There's so many health issues that the communities don't realize it's a health issue, right? Vaccines, we are still trying to sell it to families. They want water and sanitation, don't see the value of vaccines still in large parts of the world. But with mental health, communities, individuals are acknowledging that this is a huge issue and asking for help. So that adds to why this is the moment to do something about it. But from UNICEF perspective, about adolescents, what's different from younger children is that they are a huge resource in themselves. And it came up again and again and again, along with acknowledgement that maybe we're not using that resource to the best of its capacity. So we're not using the adolescents who come with so much agency and to the best of what they have to offer in the area of adolescent health, but especially within the mental health. The second is, although your theme was mental adolescent health, we could not in all the conversations, disconnected from everything else that the adolescents are going through, whether it's NCDs or conflict or family situations or education system, it's linked to so many things. So just reminded me, we very often say you have to think of the whole of child, and adolescents are children as well. And so even if the focus is on mental health or any other issue to do with adolescents, it has to be a whole of a child approach. And then one of the conversations that we are having at UNICEF is, for us, the child is under 18. And after 18, it's sort of like not our business. And we are increasingly realizing that it cannot be so. You have to tide over that hump from being a child to being a fully functional, financially viable, employable adult. And so we are doing a lot of internal brainstorming on how do we do that. So any insights when you have conversations with your UNICEF counterparts, please bring them in. And then finally, it's shocking to see how silent the HMIS is in so many countries on adolescent health issues. And so I really enjoyed this last sessions on measurement and all the progress that has been made. And we really need to move forward from just having that prevalence data to actually knowing what's happening in terms of being able to deliver services to adolescents. So thank you, everyone.
Thank you very much. Okay, and there, Gloria, go ahead.
Yeah, thanks everyone, and agreed with what everyone's already said. It's been a fantastic day and a half, and I think we've been able to be really privileged and hear such incredible green, like grassroots initiatives happening, all this amazing projects happening on large international levels. And we also have continuously heard of the structural violence and systems that we're working in that are keeping us from being able to move forward with all these wonderful, great ideas, and let's work together. What I would love to get from this, or in the future as part of this, are what are the small practical things that we can do in our own community, within this room, within our networks, when we go back to our offices or our universities. What training do we need to actually put that talk into practice? Is it that we need the empathy training? Do we need the leadership training? Do we need to recreate what mentorship looks like? How can we democratize within our own field what we're doing so that we can continue to live up to what's being asked of us? Of the adolescents that showed up the last 2 days and told us what they need, how can we commit to that without fear of retribution or fear that we might not fit perfectly within that system that's keeping us from doing the work that we want to do? So I don't know if that's an answerable question, but that's what I would love to have is those practical small steps we can do.
Great, thank you. And Corey, please.
Okay, thanks. Hi, my name's Corey, and I am so excited that this if it was open to like random public, because that's who I am. And I really loved being here. I really appreciate you putting this together. I have kind of I don't know, it's tedious. It is something that probably not too many people in this room, when thinking about kind of the bigger picture, get hung up on. But I have heard quite a few presentations mentioning that they are utilizing the PHQ-9 and the GAD-7. And those are screening tools that I came to know in 2012 when I was working in Alabama. And as a medical anthropologist, I'm reading them and going, these make zero sense for the population we're working with here in Alabama. But the psychologist I worked under said it's validated and we're not changing a word and this is how it's going to be. And then I moved up to USAID and I found out, oh, we're using these two screeners globally. And there are no somatic points of reference on there. It doesn't ask, have you had stomach aches or unexplainable headaches, which is typically how mental health problems do present in many cultures. It asks, have you had issues reading the newspaper? How many of y'all have read the newspaper in the last 2 weeks? Just a show of hands, right? And so as a community, I would really love to see this community working on better screeners that are still valid, could be valid in multiple settings, but recognizing that low income, low resource settings are going to have much different ways of presenting anxiety and depression, which I'm still sticking with those because we know that those are two of the highest prevalence mental health issues. But I do think that it is time that the GAD-7 and PHQ-9 get a facelift, and especially for adolescents globally. So that's just a plea of mine.
So I think that's one you need to share with Anna Zechariah.
But I think I'm gonna just let Brandon respond to that, and then I'll come back to you, Cosmos.
Thank you so much. And that is really what I think inspired UNICEF to try and look at different approaches. And so the MAP tool that we've mentioned, by no way is that perfect. There's lots of limitations, but we've really tried to address exactly the issues you're talking about. So for example, there's a whole bunch of somatic items because I have an adolescent and the first things I see are his stomach's upset. He has a headache, right? And then, in 10 years of therapy later, he's able to answer the rest of the PHQ-9 GAD-7 questions. So I think, many of the actors in this room are really trying to put forward with alternatives to measurement. It's a lot of what Shoshana brought up as well, that they're not even capturing things that like loneliness, which is so important to adolescents, isn't even on those tools. So for example, in the MAP, that's been included as well. But still, again, acknowledging lots of limitations there. One of the challenges, and this goes back to the idea of networks and the conversation we were just having, is a big push from Anna and the International Mental Health Research Funders is now if you are funded by Wellcome, if you're funded by Grand Challenges Canada, funded by the NIH, you're expected to be using those tools. It is mandated that you have to use those tools, even if they are not validated in your setting. So we're generating information that could be completely misleading because of it. So rather than a push to be like, here are the quality standards you need for whatever tool it is, we've jumped to everybody has to do the same thing. And I think that's appreciating the richness and diversity of experience and settings. And just as Joanna was saying, we talked to so many adolescents that all wanted the tools changed. So I think if we bring more adolescent voices into this, they will not tolerate us using, these standard approaches, but also going back to groups like the International Mental Health Research Funders to be like, hey, this common metrics, the spirit of it is absolutely important. It's vital, it's essential. We need to be doing things like that, but mandating a particularly weak tool that everybody knows has so many shortcomings, is that the strategy as opposed to pushing kind of the quality and standards approach, which I think hopefully all of us are moving more in that direction. But thank you for raising that.
Cosmos.
Hello, y'all. I'm back. I promised my last time. But to speak on Associate Director Shafiq, I won't pronounce it correctly. I'm putting it up. Associate Director Shafiq from UNICEF's point. I'm throwing my hat in the ring. I am an adolescent. That is a resource for y'all. That if you want my expertise in whatever I'm an expert at, y'all can find me and I'll help you out. but also to your poor social director. Um, I do agree that we should stop helping adolescents after 18. And it's something that I'm personally working on, and I call it going from part-time adult to full-time adult, because I have experienced firsthand the gap or lack of exceptional care or exceptional resources to help mitigate the transition, because for so long I feel like you get indoctrinated into the system. You go to school, you go to college, you become an adult, figure it out after that. But there's so many more things to adulthood that's not talked about in the educational system that has been actually taken away education system. Like there isn't any more home economic classes in a lot of places. There's no more PE in a lot of places. There's not a lot of art related courses in K through 12 anymore. So all these different things that have been stripped away from K through 12 essentially leaves a lot of adolescents in this day and age kind of lost, especially after college. Because your 20s, as you guys can probably attest to, is a time of mistakes, a time of confusion, a time of what the F am I going to do with my life, especially if you don't automatically have a career lined up for you right after college. So yeah, I'm currently working on making a workshop to kind of handle the discrepancies and the issues going from part-time and full-time adulthood. And anyone here wants to help me with that or wants to my advice or anything else, my hat is in the ring.
Thank you very much. I also just want to underscore, Rachel, what you said about these narratives, right? About the parents on the room, the narratives of older people who are still thinking about the way things were in our time, and what influence would that have on the way we either allow adolescents to speak or the way we receive the information, right? That people. So I think that's a very interesting point to everyone to kind of think about. Yeah.
So to add on to what was discussed, feedback off that, it was brought up a few times, but that early adulthood, I think that we definitely shouldn't ignore that. While it's temporary, while I'm in my, so it's a stage of growth and trying to figure out what's well, it's also a time to reflect on. You know, what worked, what didn't work, you have to questions for that lesson, which we should definitely still ask them, but we, young adults, may be able to what was the issue, what worked, what didn't work, and what or what at that point.
So it sounds like we're hearing that we want to pay attention to young adults because number one, it's a challenging period of transition from 18 to 30 perhaps, but also you have proximity to younger adolescents. And so a great bridge for communication with that. Beforehand.
Thank you. I think one other thing I also wanted to highlight is how going forward, there could be more attention paid within the context of global mental health, how lessons could also be learned from the global south to the global north. I think as we try to, establish the cross-cultural engagement and exchange, it'll be very great if the science moves to say, okay, what can we learn from the global south that could be applied to the global north, especially as cross-cultural migration is becoming also more of a concern. That is also something that going forward, future global mental health research could also focus on. That's my thoughts.
Thank you. That kind of aligns nicely with the reciprocal innovation we've been talking about, this bi-directional and learning and mutuality. Okay. One more here. Please.
I was just thinking about a question I've been thinking about for some time. This was so wonderful. Thank you all for these 2 days, every single person here. Is what role can the institutions and all the structures we've been learning about in the communities and families and other individuals help create environments for adolescents to do something we all cherish so much, which is create a more peaceful community and society. Because I really think they could be at the forefront of this from everything I've heard and from.
Thank you. What do structures do? How do we engage structures and community structures to support well-being and peaceful societies? Question. All right, what I want to do now is just invite the commissioners in the room to come to the stage. And we're just going to wrap up with just giving the commissioners a chance to say a closing word. So we're at the end of the session. Thank you for this time of discussion. I appreciate folks sharing what's been on your mind, raising some questions, answering other people's questions, giving us a chance to reflect on what might be some important, very local steps and what might be some important communal steps to go forward. And I just wanted to give the colleagues here a chance to reflect on anything you've been thinking about as we close out. And I also want to just acknowledge that we are a part of this large group. You've been looking at their pictures as teenagers and adolescents, and this is what they look like now, what we look like now. But want to acknowledge this amazing group of commissioners and the work that went into putting the report together. And also want to express thanks for all of that work. And express thanks for all of you who have been thinking about mental health and have been contributing to the field of adolescent mental health for a very long time. So maybe we'll just start with you, Alex. Any thoughts and reflections you have as we close out?
Okay. Thank you very much, Pamela. And really, thank you for hosting this launch event here. It's always a pleasure to have commissioners take lead in driving elements of that work that we did together. You might ask yourself, you're here maybe because you're interested in adolescents or you're interested in adolescent mental health specifically. But why the focus on mental health? The commission and its report is much broader than mental health. And over the last, I wasn't here yesterday, I had a 3-hour class that I was teaching, and then the 2-hour office hour, and then I had to come down here after that, so I got here in the night. And but throughout today, we have heard about this, the field and how complex it is. But we are talking largely around adolescent mental health. But it is not the only issues that adolescents are concerned about. In the commission, we read it. So if this meeting was so useful, where my colleague Ali Groves and myself and others that were part of the commission, they've done a lot of work on adolescent sexual and reproductive health issues. Maybe it will be on adolescent SRH issues. And we can spend 2 days talking about it, and the challenges are enormous. If this meeting is maybe at Georgetown University, where Sarah Bird has been and is, it might be on adolescent violence. While violence may be related to mental health, it is still very different. And throughout the commission, we've taken the approach to use mental health, to use SRHR, to use violence as pointers to the range and complexity of issues young people are faced with today, and how we can ensure that we are looking at how these issues intersect with each other and make investments at points where they can drive benefits across these multiple drivers. Because even if we address adolescent mental health issues, but they are getting married at 14 and 15 and 16, what have we achieved? Even if we address adolescent mental health issues, but half of them are exposed to civil conflicts and violence and of different types. And what have so it's really important that and when, as Yusra told us, the more of this broader agenda that we bring on, the higher it is to actually make a case for it. And as a field, we have to begin to think, okay, how do we actually move the needle here? One of the things that really, for me, got to me in going through this process of doing this work is the recognition that a lot of the investments we are making in children and young people, like my friend at UNICEF, you focus on 0 to 18 or to 17.999. Is that a lot of those investments are being lost in adolescence. And for the first time in our history, we're having adolescent health falling behind child health. And I think it's a wake-up call because we are having for the first time the largest group of the adolescent population that will ever live on this planet. They're there now. From the beginning of whatever time to the end of time, this is the time we will have the largest number of them. And they are facing the greatest challenges today. I think it's important we understand that so that in the various places and what we do, that we are paying attention to those other issues. The second thing that I really took, and I think that has been the spirit of this meeting, because at every single session, at least those that I witnessed today, we heard the voice of young people. And in this commission, we took it to heart that, the point that not for us without us. I think that's what we heard consistently from young people, that it's not enough to plan for them. It's not enough to design policies for them. It's not enough to, you have to meaningfully engage with them. And I think they will rise up to the challenge. Every single thing we put before them, when we convened a review meeting and we brought young people to look at the first draft of the report and tear it down and give us a direction forward, they rose up to it. They were there. They came with their agendas, with their points, with their views and all that. When we create the opportunities, young people take advantage of it. So don't, and maybe we had a special group of young people in our commission, like Tina and others, but they always rise up to those challenges. So as we leave from this meeting, I think this is the start of a conversation. And I do hope that you will carry the spirit of this report and the commission and what we have done, the recommendations and others to whatever you do and how you work with young people in your various programs and work. Thank you. And thanks again, the team at Johns Hopkins for hosting us in this wonderful place and leading this effort here. Thank you.
I can just talk about thank you, Alex. Yeah, I just want to also echo thank you to Pamela, Tina, colleagues for organizing this. This has been wonderful. I'll make my point very short. I think one thing that's always struck me throughout the commission process, and then definitely at this meeting, was the vibe, the positive vibe. So I'll share something. When we met in South Africa for the meeting, I still remember I made my PowerPoint presentation, and I just remember after giving the presentation, I felt like it was so negative compared to the rest of the meeting vibe, and it contrasted just so much how positive and impact, like how positive just having adolescents be part of the group, but also just the framing of the commissions, having been part of many groups like this. I think what stands out about this commission is just the positivity, and also just I've seen such immense progress, just the amount of work that has been done, not just part of this commission, but a part of all the groups that have been presenting and yeah, just a significant progress. So I just wanted to, I think the thing that struck me the most is the positivity and just the amount of momentum and energy in this group. And that gives me a lot of hope. So.
This has been awesome. Just being in the room with like-minded people online, listening, I think it's a huge step having brilliant brains in the room to talk about these critical issues, but not just talk about it, but take pieces to make action. And what I really think about is that every young person really just wants to be seen, heard, and valued, right? I've aged out of the adolescence, and as I'm reflecting on my role currently, as we mentioned yesterday, I think it's part of building the infrastructure to make sure that adolescents have space to have their voices heard in these institutions that did not have them heard before. And we're in a unique turning point where people are starting to realize that and understand that youth engagement is important and that youth engagement is going to be the solution to a lot of the issues that young people are having. So as we move forward, whether you're like an older adult or like me in this out of adolescence part, I think we all have a role to play in creating and rebuilding these infrastructures, thinking about everything that went on. And I heard from the conversations, the community building, the sense of belonging, reciprocal learning, the hope. We're in a really crucial time right now where a lot of things can feel hopeless, especially just talking to younger people. Like they feel like there's no hope. And I think hope can be action. And that was raised yesterday. And I thought that was really interesting as well. So yeah, I see all of us playing a role in the work that needs to be done and making sure that we're elevating youth voices, we're bringing them to the table, we're creating spaces where they can actually make real change. And I think that is how we're gonna really make sure we galvanize this huge group of adolescents that we're living with right now.
So I was struck when, Alex, you asked this morning, how many people live in cities? Now, of course, we're meeting in a where it's very easy to be in a city. But I was struck by that. And I was also struck that for me, and I think a few people have expressed this, and Gloria maybe just a few minutes ago, I think what I take from this is the opportunity to localize some of the things we've talked about, right? Is to say, okay, how do we move this forward for me, in my specific city? What does that look like in the place where I live? And I'm also struck by when you defined a coalition as who's not at the table. I thought that was very interesting because I tend to think about networks, and this is a diverse network in many ways, and yet it's not a coalition because it doesn't. You are all the choir essentially here, and so building a coalition that includes people who are not part of the choir, figuring out what that means and how we do that effectively, I think is a very important challenge for us, especially now. So that stands out to me as something that I would like to figure out how to do. I think the other thing that stands out and resonates to me is how this conversation flowed into talking about belonging, talking about empathy, talking about these bigger concepts that are so important. I think not just here in the United States, but I think these are important in many places, right? That they're important for a sense of well-being for young people, but young people don't live in a society by themselves. They're important for all of us, and exploring what the role is of going a bit deeper and trying to understand how we apply these concepts to the work that we do. I'm also excited about thinking more about that. So we've all worked hard. And again, just want to thank all of you for being here. And before we close out, I also there was a wonderful group of advisors who came together to help us think through and plan this meeting. And I want to acknowledge Prerna Banati, who from WHO, Jennifer Acacia, who had to leave a little early, Isaac Lara, Shami Fineglass, Judy Bass, Afshal Lakhani, Tina Mensaklau, Montserrat Baji, Cecilia Dedios, and Shoshana Fine, who were part of the group that helped us think about how we want to use this time and how we want to shape the agenda. So thank you to all of you. I want to thank again the team that has been behind the scenes doing all the logistics. And of course, Afshal Lakhani, our managing director for the Center for Global Mental Health, really led that effort. Danielle Edwards, our administrative specialist from the Department of Mental Health, was a big support for her. And you all recruited a group of students who are here now. And if you're a student, stand up and let us recognize you. We really want to thank you all for coming and taking the train up here and getting here and being here, helping us to make this happen. And we just want to thank the folks. We've had a wonderful support here at the Bloomberg Center, helping us to bring all this together and creating a nice experience for all of us. So I want to thank Tiara and her team for that as well. And with that, thank you all. Travel well and let's stay in touch.